Recording.
All right.
Go ahead, Robert.
Hey, Robert.
Good evening. I am here with my mother-in-law, who is 84 years old, and her name is Norma. And this is it's her first time sitting in. I thought I'd take advantage of a situation and ask you for some assistance.
Sure.
She was in an auto accident about a week ago.
Okay.
And in that accident, her vehicle rolled over twice.
Oh, boy.
Yeah. And it's a miracle that she's sitting here with us. And in fact, let me unmute my video and point it that way. Oh, one moment while I eliminate my background. There, now you can see her.
Hi, guys.
Hey.
So she's having some effects from the accident, but there's also a litany of other conditions that she's had for quite a while.
Okay.
Since the accident, we've been putting galbanum on her wrists several times a day, and that's helping. Yeah, it's helping a lot. Whenever she does it, her pain usually goes away in about 3 or 4 minutes, or lessens. So we're excited about that, but there's other things that are as important. But let me finish the accident part of it. She has a fracture in L1, a compression fracture, and she's wearing a brace that you can see on her partially at the moment. Right. And so that's causing pain.
Okay.
She has very minor lacerations on her 2 hands. And my wife says she has bruising on her back.
Okay.
Okay.
And so with the fracture down in L1, that is the body, or is it the transverse process or the spinous process? Is it the little bones that flare off, or is it the body of the?
From what we know, it's the body.
Okay. And the history of osteoporosis or anything like that?
Would you say you have osteoporosis?
I don't know.
No, doctors never brought it to our attention.
No, not really.
Okay. All right. So galbanum was a great, great go-to right off the bat. The other thing that I would augment that with would be 2 to 3 drops of black cumin. If you don't have it and you just want to get it, you could also go to the health food store and get black seed. Black seed, black cumin, real super similar. And like 2 or 3 capsules of it at a time. That should help to reduce the inflammation and kind of somewhat stimulate a little bit of the rest and repair mode, the parasympathetic activity.
Okay.
And so the galbanum and the black cumin are a good 1-2 punch for any sort of traumatic injury like that. Tarragon can be used for its antispasmodic property and also to reduce any of the emotional shock or trauma from the event. If she's not really feeling it too much, the galbanum will also help that somewhat, but the tarragon would help a bit more. The other thing that we're always wanting to be concerned about, this one's a little bit more unique because usually you're getting hit from, a different direction and your neck kind of, snaps one way or the other way. And here, when you have a roll, the neck can go all over the place. And sometimes the neck doesn't do anything. You know what I mean? It can be other parts of the body absorb the injury. And so the thing that we're concerned here would be keeping the breath deep and regulated. And so you could do this a couple of different ways. Having her just inhale hyssop daily would be good. You could also use larch. If you start to feel that her breath is getting a little bit more shallow or a little bit more rapid, switch to a lang-lang. A lang-lang will help to slow down the respiratory rate. Because there's one thing of deepening the breath, which relaxes the diaphragm and is going to relax some of the muscles in the neck that would get injured with a whiplash type injury.
Right.
This one, I mean, she could have, you know, a whiplash, maybe not. I mean, a lot of times it doesn't even show up for several weeks. And so deepening the breath is always good. It will help to reduce the pain, especially that she's experiencing some pain from the fracture. The sharp pain is going to eventually cause her to have some bronchial spasms. And so the larch or the hyssop will actually reduce that. That you guys started doing galbanum pretty quickly. I mean, the bronchial spasms might not even happen. Like, you know, if you keep the edge off, like the bronchial spasms are a direct byproduct of pain intensity, you know, so if the pain is more intense, the spasms happen quicker. If you diminish the intensity, they just don't happen as quick, or sometimes they just don't even happen. And so that you're already on top of that is perfect. The other thing that we always kind of want to like look at is you could give her some like anise, or again, we could fall back to the tarragon, but anise is a little bit better for balancing out the different parts of the autonomic nervous system, you know, between action and activity, or fight, flight to rest and repair.
Okay.
And it will also relax the diaphragm somewhat. You know, because part of the issue with the diaphragm is the neurological component. I would say the galbanum and the black cumin would be the main things that I would have her on, which you already have her on a part of it.
And I have black cumin, so we'll start that this evening.
Yeah,
2
and
3
so
drops once a day.
yeah, like I'd start off with 2 drops and then maybe work up to 3 or 4 drops, but just once a day should be enough.
And for how long? A couple weeks?
Probably a couple months. Like,
Oh, okay.
I would really ride out you just keep reducing the inflammation for a period of time. You know, not all the inflammation is going to appear right off the bat. You know, you're going to have some nerves that are compromised, and eventually it's going to cause greater inflammation. And if you kind of break the cycle, even like as it's happening, or you start to prevent, a lot of times it won't even manifest. And so, or it manifests very minutely.
Now, I don't want to spend too much focus on it, in that there's other conditions that she has.
Sure.
And I know they all play into each other at this point when there's trauma.
Right.
So just as bullet points, urinary incontinence for over 20 years.
Right.
Depression, she's been on medication for over 35 years.
Okay.
Chronic cough for about the last 2 years. And it's not a constant cough. It's random times she just coughs and then she stops.
Is it a coughing fit or just a little like?
About that.
Yeah.
Yeah. So what I'd call that is a spasmodic cough. And a lot of times it's the same muscle that we're concerned about from the car accident, the sternocleidomastoid. When it tightens up or is in a little bit of a spasm, it actually causes a little bit of a, like a, you know, it's not really producing mucus. It's not really because something's in your throat. It's not because you have allergies. It's actually literally like a little spasm that happens that actually produces the cough. People can have those for years and years and years. And it's actually those 2 rope muscles down each side of your neck. They get tight, they go into a bit of a spasm, and they cause that cough. And so the other thing that could help a lot of different things is the application of marjoram on the neck and shoulders, even down the back. I'd probably put it in like lotion or massage oil. You could also do it in a base of, like, if you wanted to do more of a liniment, you could do it in like alcohol or witch hazel, and, you know, just warm it up in your hands a little bit and then just rub it on the area.
It would be okay in a lotion?
Yeah.
Lotion? Okay.
Yeah, about 15 drops per ounce of lotion.
Perfect. We have some already.
Perfect, perfect. And so that will also help that bone to heal at a faster rate down in the low back.
Okay.
It will decrease muscle spasms, and it will also help to tone up the part of her nervous system that has to do with rest and repair and pull her out of any kind of fight flight response because of the accident. I mean,
Okay.
that's kind of a given that that happens. I mean, some people it's more intense than others, but it's going to be there just because there was a traumatic event. I mean, it's just your physiology reacts.
Right. So
Right.
the other condition to throw in the mix is IBS and constipation.
Okay. Yeah. IBS, constipation. And is there bouts of like loose bowel movements?
Loose.
Yeah, do you ever have?
Yeah,
any?
like diarrhea,
No.
real loose. No,
No.
it's just more constipation.
And that one pain that I have is right down here.
She has a pain, I would say her hip, at the fold of the leg.
Oh, the creep. Oh, right in there.
Yeah.
Is that just been since the accident, or has that been going on a while?
No, that's more new. That's a new
That's
thing.
That's new.
accident.
Let's have you start with putting marjoram on that.
Okay.
Yeah. Did they x-ray the hip?
I don't know off the top of my head.
Okay.
I can go back and look. I have the records.
Yeah, I would be curious if they did x-ray the hip. I mean, if they didn't, it's okay. But, you know, I always like to have like a little bit of a baseline if the information's available. But marjoram on that area as well. You can always mix a little bit of helichrysum with the marjoram just to reduce inflammation. And if there's any pain or bruising, the marjoram will take the bruising out very, very quickly.
Okay.
So the irritable bowel, honestly, for that, I mean, you could go a couple of different routes. Given the age and everything, given the age, I would probably actually put her on not oil, but go to like Amazon or the health food store and get wormwood capsules. You know, there's an oil of wormwood, but the oil is too potent to take internally. And so I would put her on probably just like 2 capsules a day for a little short time, like maybe 3 to 4 weeks, and then would revisit how that's treated her. So a couple of things. It will help reduce like the irritation that's in the gut. It helps to calm and soothe the nerves and allows them to function a little bit better. Usually I would use that more if there was more loose bowel movements or diarrhea, that it's more on the constipation side. It could be actually a lubrication issue, like the mucous membranes aren't lubricated enough. And
that could, I don't know if that's a byproduct. She's taking medication for her urinary incontinence, and it tends to dry out her mouth.
Okay, that's okay. So that's probably what it is. Okay, skip what I just said about the wormwood.
Okay.
Let's have you either use the oil of Schizandra or get Schizandra herb from the health food store and have her take that. If you're using the oil, about 2 drops a day, probably right before she goes to bed. It will improve the quality of sleep, but part of what Schizandra does is it helps to like moisten the mucous membranes. So it actually would probably reduce the dryness in the mouth, but also in the mucous membranes down the digestive tract. If you're going to get capsules from the health food store, probably like maybe 3 capsules a day would do it. The other thing that I would suggest for something like that might be a little bit of like flax oil or like some flax seeds, or you know, you can get flax already, the oil already in a capsule, and you know, like a gel cap, and take
Okay.
that. So whatever works for her. Like
Okay.
the downside of the flax oil is that you got to keep it refrigerated.
Yes, we have flaxseed in the house. I know we have flax oil in the house.
And it, yeah, so give her some decent dosages of the flax.
Okay.
And that should actually, I mean, if it doesn't work, that tells us something, but that will probably resolve the issue.
And when you say decent dosages,
Yeah, like start with a teaspoon maybe, and then you can work up to something bigger, but teaspoon's a good healthy start.
okay. Very good.
Yeah.
Anything on the depression side of it?
I'd say let's get these other things. Like, I think if we get the gut functioning a little bit better, the depression could minimize a little bit. But
Okay.
A lot of times what happens with depression, it could be long-standing body fatigue, like nerve depletion, body fatigue. And
Okay.
so some of the things that we are putting in place should start to remedy that. It's not like a super aggressive approach, but like I'd say, I don't want to also overwhelm her with a bunch of things to do.
Right.
These are good things to get her going. And then in about 3 or 4 weeks, I'd say, let's revisit. Even to go through and treat that component of it. You know, something soft could be something like geranium or sage. Sage could be very nice. I would probably make it like in a witch hazel or alcohol base and like put it on the body like a liniment. She could also take a bath in it. But I usually do pretty heavy dosages of it. I usually use Spanish sage, and like a 4-ounce bottle, I might put like five mils of the Spanish sage in it, and then have them apply it.
Okay.
That it does a couple of things. It strengthens the body. It is good for depression, and it calms down the sensory nerves and helps to strengthen the nerves and re-educate the sensory nerve endings. And a lot of times, I mean, a couple of things could be happening. It could be that there's some body fatigue. It could be that the sensory nerves get overstimulated, and it's like just overwhelming to the brain, and actually can cause some brain fatigue. And so until you kind of calm down those sensory nerves, the brain fatigue is going to be hard to treat. And so
Let me give you one more piece of info.
Mm-hmm.
Her mother and her father both had depression.
Okay. So there's a biological or genetic component.
Yes.
Yeah.
And then as a second thing, the question about the liniment, once a day, twice a day?
You could do it twice a day. I mean, once a day is really good. I'd rather see it more consistent, like, you know, day after day, rather than a big dosage in a day. But if everybody's gung-ho about it, you can do it twice a day, like morning and night.
Okay.
Yeah. Yeah. I like the sage more than other things that we could use, because some of the other things we'd use could possibly be a bit more of a diuretic. And so that would aggravate the bladder, and the sage shouldn't aggravate the bladder too much.
Okay, great. Thank you very much.
Yeah. And so like email us if there's questions and everything, but let's start with that. And, you know, in 3 or 4 weeks, we'll go through and reevaluate and move forward with that. But these should definitely start her like feeling better. And then as a little bit of time goes by, we'll augment what we're doing, adjust it, you know, whatever it is. And, you know, we should be able to resolve it. The hardest thing is probably going to be the depression, just because of the genetic component. You know, it could be brain chemistry, could still be the nerves. You know, never rule out the nerves. But sometimes even some forms of depression actually can even be digestive in nature. I mean, it sounds kind of weird, but the digestive system can really throw off a lot of things. And so that the mother and father both had it. I mean, it definitely sounds more biological. just because of, parents having it.
Right.
And so let's get these things going. And then since it's been long standing, let's start just fixing some things. And then when we get to the 3 or 4 week mark, we'll kind of process the information and then make some adjustments and then maybe go after it a little bit stronger.
Right. And we're having a virtual follow-up with her primary care tomorrow. And
Oh, tremendous.
we'll ask about the hip x-ray and see if he
Okay.
considers it important. And if he does, that's more info.
Yeah, I mean, if they took it, they thought it was important when she was in there. And if they didn't, we'll just treat it as soft tissue. I mean, almost all pain is coming from soft tissue. Sometimes bones are compressing a nerve, but given its location, I just want to rule out that there wasn't some sort of fracture or strain or something like that. But that's not even going to show up in the x-ray. We're just making sure that there wasn't a fracture, basically.
Right.
And given the age, has there been any history of like prednisone use or anything like that?
You use
What?
prednisone?
Prednisone?
I don't think so.
No, I don't think she
No.
has.
Okay, perfect. Okay, so yeah, let's start with these things. If the bone is slow to heal, let us know, because there's other things that could be done, but I think we have enough in place to where that should be pretty solid. And if it's not moving along, there's a little bit more aggressive things that we can do. But I mean, part of the thing is I don't want to overload her with a bunch of things to do. So
Right.
like trying to do a few things that are a lot of bang for the buck, you know what I mean? Like, or bang for the effort, I should say.
Yes.
Where, it's going to do multiple things. It's not going to aggravate any conditions, but they kind of overlap in some of the things that they're going to do. I think we're pretty solid with our initial approach, and we'll go through and adjust as time goes by.
Excellent. Thank you very much.
You're so welcome, Robert.
Bye.
All right, take care. Nice to meet you, by the way.
Go ahead, Sandra.
Hey, Sandra.
Hi, Craig. You may have already answered some of my questions by talking with Robert, but
Okay.
I am working with a client and have been working with her for 2 or 3 weeks for anxiety and other things. And
Okay.
yesterday, she called me in a full-blown panic attack. I mean, so
Okay.
she was hyperventilating so much that she could hardly speak. And so I thought, well, how do I get this woman out of this? So
Right.
the only thing I knew to do is I walked her through how to do pranic breathing so that she could.
Oh, yeah. Yeah,
breathing.
tremendous. Yeah. Did that help?
That she has some brain problems too, so she probably wouldn't remember to do that again. So
Okay.
I was thinking, what essential oils would be the best thing that she could take to help her get into parasympathetic when she's,
Yeah. So
I thought
it was
about
the, what's that?
I thought about hypsipdecumbens.
Yes. So, okay. So, are the panic attacks new, or they've been long standing?
She told me she was abused as a child, and she's had them on and off her entire life, and she's in her late 60s now. She's had lots of psychotherapy. She's been on Xanax, I can't believe it, for 30 years.
Yeah.
And she's still having these. Obviously, it's not helping her. So I was just wondering, she doesn't have a lot of money, but if you could give us some idea about maybe a couple of oils that she could use, that she could just inhale when she starts into one of these.
Yeah. So, boy, long-standing panic attacks, anxiety, and the abuse was sexual or physical?
I think it was sexual.
Okay. Okay, give me just a sec
Sure.
here. Where did I put that? Okay, so okay, so this is why I'm kind of like hesitating. It's not that I don't have a plan of action. It's like okay, this is what I would say.
Okay.
So with panic attacks, like it sounds like panic attacks can be a lot of there's several different like causes or sources of panic attacks. It definitely sounds like hers is respiratory in nature, even if there's other things going on, like the center of it, like if you can kind of like you were already going in that direction with getting her to do the pranic breathing, the more that you can regulate the breath, the more that the panic will diminish and eventually the anxiety will diminish. Now, here's the issue with calming down the breath. You start to also calm down the lower emotions. And as weird as it sounds, a lot of our lower emotions get generated in the sex chakra. They, they're unconscious, they're very primal, they're not something that you think about, but eventually it causes an emotional response, and eventually it causes like the instinctive mind to get triggered, and then there's like a cascading effect through the different aspects of the mental body and so on. And so when you start to calm down the breath, the potential issue is some of the issues with the trauma is going to come up.
Oh.
You know what I mean? Like there's going to be, I mean, one of the things that happens when you start to calm down the generation of lower emotions, the kind of the first issue that comes up is abandonment. I mean, it's just like any sort of abandonment or traumatic, issue starts to come to the surface. It passes, but it's not like the breath comes down and you just go, oh, I feel awesome. It's like the breath comes down, you feel good, but then you start going, okay, wait a minute. Now that everything's calm, I'm aware of there's another problem. You know, does that make sense? And so you are a pranic healer?
Yes.
Okay, so let's try to remedy it with like doing like a little bit of a a multifaceted approach. Okay,
I have been doing psychotherapy on it.
What's that?
I've been doing pranic psychotherapy on it, which works anywhere from an hour to a day, but it doesn't seem to hold.
So this is what I would suggest is there's going to be 3 oils that you use, kind of just like boom, boom, boom. You know, I would have her start using them before the panic attack, but during the panic attack, she could also rotate through them. So the first one would be ylang ylang.
Okay.
That would slow down the respiratory rate. And when somebody's having a panic attack where the respiratory tract is involved, it's short and rapid. Like it's really super, super rapid. Like if you look at them, they're breathing really super fast and really super shallow, right? So you're starting to calm down the breath, right? Then the next wave is you'll use anise or anise, however you want to say it.
Okay.
That is starting to balance out the the rest and repair with the fight
Mhm.
flight. Like sometimes I use anise, sometimes I use marjoram here. Like
Okay.
and the anise balances out the nervous system, but
Mhm.
sometimes they're in such fight flight, and like I kind of keep going back and forth with her. It might be marjoram better at first, because the marjoram, it pulls them out of fight flight. It relaxes the body, it calms the body. It's actually very activating to the heart. It
Mhm.
helps to transmute some of the lower emotions.
Mhm.
I'm kind of leaning a little bit more to the marjoram.
She has marjoram,
Okay,
and she's
beautiful.
using it for, I had her use it for esophageal spasms, which I
Yeah.
think are connected to her anxiety. So I know
I would
she
agree.
already has that. Okay.
Okay, I would agree. So if she is having the spasms in her esophagus, the anise would help that as well.
Okay.
Like because there's that, and then there's also like gulping of air, like when she's
Right.
talking or eating,
Mhm.
and would produce like some gas or some like weird things with her stomach. But it's basically that spasm in the esophagus. The anise will actually knock that out. Like it
Okay.
might take a little while, but it should knock it out.
Okay.
And so she could do them both, or she could do them independently, and then either hyssop decumbens or larch. If you already have the hyssop decumbens, like I would say, just rotate between the lang lang, either the anise or marjoram, and then followed by the hyssop decumbens. Right?
Okay. And you
And
say that she should take these all at the, well, one after another? Is
yeah,
that correct?
like inhale it like 10, 15 times and then move to the next one. Inhale it 10 or 15 times. If
Okay.
she's using the anise, I would actually have her put a couple drops in water as well and take the anise internally.
Okay.
Yeah, that will decrease the spasms in the esophagus and start to balance out her nervous system a little bit more.
Okay.
But she's been on Xanax for so long, it's probably gonna take a little while. You know,
I know.
the body gets kind of trained. It depends on how she was taking the Xanax. I know it's a weird thing to say, but like if she was just regimented and taking it like, 2 or 3 times a day,
Mhm.
or that's one thing. But if she was taking it when she's having the panic attack, there's almost like that Pavlovian response that when she starts to have a panic attack, she's used to like taking something.
Right.
And that can actually almost like exaggerate the panic. At first it calms it down, but after a long period of time, it actually starts to aggravate it more, because there starts to be a need for the substance. It's not necessarily an addiction. It's almost just like the body gets used to having it.
Right.
And so,
Habituation, in other words.
yeah, that's a great way of saying it, right? So now, with that, there is going to be, as you calm this down, and please keep me posted on this process.
Okay.
But as you calm it down, there is going to be traumas coming up and or abandonment issues, just even related to the trauma. And so like the normal psychotherapy would be like, with chronic healing would be to clean the solar plexus, the throat, the ajna, the crown, all those kinds of things, clean and activate the heart.
Mhm.
All of that's really super good. But here we want to spend a lot of time cleaning the sex chakra, especially the protective web.
Okay.
Like really clean the protective web. And so oil wise, it's not a cheap fix. It's like poplar balsam is what I would use. And so I think the more cost effective thing is for you to do healing on the area and clean that up. So sweep it with violet and then a little bit of electric violet and then switch back to violet and then a little bit of electric violet, but just keep switching it back and forth, back and forth. And so as you do that, it's going to make the heart, the throat, and the crown expel. At first, it's going to be mostly the heart. So after you clean that up for a little while, you're going to move your way up to the heart, front and back, and then eventually the throat, and then eventually go through and just clean up the crown. But for the first while, 5, 6, 10 times you do it, it's going to be primarily the sex chakra.
Okay. That
check
makes
the heart a
sense.
little bit, but
Mhm.
at first it's going to take a little while to unwind it. And then over a period of time, you just keep working your way up. You know, you're basically following the pattern for transmutation, you know, from
Sure.
sex to the heart to eventually the
Yeah.
throat. And I'd hit the back throat as well. So throat and back throat, and then eventually the crown. The crown will start to expel much further down the line, but that will start to affect the thought processes associated with the trauma.
Another thing
Eventually, you're going to have to do some work on cleaning up the spleen and the navel.
Okay.
But I would say for right now, let's get her out of the panic mode. Like that's more like long-term for treatment of the past traumas and things.
Mhm.
But the spleen is associated with the sex chakra and sex function,
Mhm.
and it also has to do with desire, right? And like things in the unconscious, and so because of the trauma, that gets impacted really super hard, and the navel has to do with regulation of the lower centers, and so when the time comes, I'll talk you through how to do it, but
Okay.
there's a way of cleaning the navel that should start to regulate all the lower centers and would probably regulate the anxiety and the panic, but it's not going to do it right off the bat. Like this other stuff has to be kind of unwound first. Like it's been there too long. You know what I mean? It's like you're having to like start walking it backwards. And so if you jump too far ahead, it just will be ineffective. Even though it needs it, it's just there's too many other things going on. So start with the breath, start cleaning up the sex chakra, and then as time goes by, we'll go through and have you do, you know, more of the upper work, and then eventually we'll be focusing on all the lower centers, the navel, the spleen, the migmen, the sex, the basic. A big component of this is also going to be the arms and the legs. Like you got to clean up the arms and the legs, but right now that's a little premature. Like you could clean them up a little bit with electric violet. It's not that you would do harm. It's just, again, efficiency of effort. You know, it'd be more effective to do the things we're already talking about rather than jumping up into the arms and the legs. The arms and the legs, when you open it up, is going to make more stuff come to the surface and flush out of the lower centers. But if the lower centers are already super impacted, which is usually what happens with abuse, like the lower centers are just super congested, like super congested.
You know,
and
this
so,
is interesting because her Mingmen, I mean, excuse me, not her Mingmen, her solar plexus chakras are depleted. I mean, I mean, they're so small, and her spleen is too. And I'm constantly working on that, trying to balance them, activate them. And I suppose that comes with abandonment.
It's the lower centers. It's the lower centers are they're depleted, but they're depleted because they're congested. And like, so as you kind of unwind what we're talking about at first, it's like a slow, kind of stable way of doing it. As you unwind it, eventually, like I said, we'll spread out to the lower centers, but all those lower centers will actually strengthen the solar plexus and the emotional body. Like if think of it like this, if there's too much lower emotions, they get stuck, and it becomes like difficult to have like higher emotions. Like it becomes difficult to have like an activated heart. And it's not that they don't have an activated heart, it's just that it would be bigger than what it is because the energy is not moving up, or the centers are so depleted. It's like almost like the heart doesn't have the energy to feel, right? And so it causes like body fatigue, and it can cause some emotional depression. And it's really, as much as they try to process through it, it's like it's a mechanical issue. Like it really is a mechanical issue. And so by going through and treating it like this, It takes a little while, but what will happen is you'll keep having a progressive like approach where you won't have to keep doing it over and over again. Like you'll kind of unwind this and then you kind of move past it and you start doing the next phase, and then you'll kind of move past that and then you'll do the next phase and then you'll move past that. So there'll be probably half a dozen different phases, but slowing down and deepening the breath is one, and then cleaning up the sex chakra at the same time. That combination should do quite a bit.
Now, do you think super brain yoga? I've taught her that because she has memory.
Yeah, I
think
would
that would
probably
be
clean
helpful?
things up a little bit more before you do that.
Okay.
Like the issue might be that the energy moving up, it might be a little contaminating, or it might be a little bit where it makes her kind of process the trauma a little prematurely.
Okay.
Like, so sometimes it can be helpful and sometimes it can be a little too much.
Okay.
And so with abuse patients, I usually don't have them do it right off the bat, or I do it a couple of times, I see, and then if it's okay, we move forward. And if they had like a weird reaction, I just stop it for a while.
Okay.
And so a lot of times you can tell, because if it felt good to them, they'll keep doing it. And then if it didn't feel good, they usually don't keep doing it.
Okay. Okay. Thank you so much. This has been very, very helpful.
Keep us posted if you need to email us or something to walk through that. But yeah, please keep me posted.
All right. Thank you so much.
You're so welcome.
Go ahead, Kathy.
Hey, Kathy.
Hi. I was remembering the class I took a few classes back, and I have so many taped ones to rewatch, where you use the blue triangle or the acorns when you wanted to kind of like throw something into the blue triangle. Do you know what I mean? Which class would that have been? So I can go back and read this.
I don't think that part got recorded. If I remember right, but basically you can do like a little prayer. Actually, you could use blue, but actually what we started doing around here is we actually were starting to use gold, and gold just seems to draw more out. And the place where Master Choa got that information was out of a Franz Bardon book. And in the Franz Bardon book, they don't use color, they use like a spiritual energy to do it, which would translate to more like physicalized spiritual energy would be gold. And so the way that we were doing it was kind of more in the vein of the Franz Bardon stuff that Master used to have us read. And instead of using the verbiage, you would hold an image in your mind as you are pointing to the triangle. And so yeah, I should probably do a different version of that, and we can record it. And maybe like at first I do it with my finger, and then I do it actually with my dorje when I do it, but it's really super strong that way. Might be a little much at first, but basically just like paint a gold triangle, right? Paint it gold, like so your awareness is on your crown and your throat, and you kind of just draw out a gold triangle, and then point your fingers towards the triangle and hold the image of what you want to let go of, and if it's just a thought or a feeling, just tap into the thought or feeling. You don't even have to use any verbiage.
Okay.
And then offer it up.
Okay.
Yeah.
I remember at the time I thought, wow, this is a good tool. And then I kind of forgot about it, and I didn't know it wasn't recorded. So
yeah.
And could you have Samantha or somebody type the name of that book of Master Choa's that you were referring to?
Oh, it's actually Franz Bardon. Yeah, I'll have to go through and look up which book it's in.
Yeah, just
I have it. Yeah.
In the chat.
Yeah.
Okay, and then I do have a couple friends. I told them I was going to ask. They have overactive bladders. Is there an oil for that? Like having to go to the bathroom like all the time.
neurological function. There's never like one particular thing that works really super well for that. Again, you can use marjoram sometimes for that will work, and sometimes that anise or anise. The anise I would probably take, actually both of them you could take internal. The marjoram I would probably also put on the lower abdomen if they choose to use that. It takes a little while for it to work. It's not something that instantaneously works because you're basically kind of re-educating the nervous system. The reason why I like marjoram is it does pull you out of fight flight, and sometimes the overactive bladder is due to overactive adrenals, and so they calm down with the use of marjoram.
It was funny. She went to some appointment of mine, and she had to go to the restroom like 3 times to my 1. And she's a person I would say kind of has lower energy. So I don't think of her as a high adrenal.
So the adrenals can be overactivated, but also depleted.
Okay.
And so sometimes what happens with overactivation of adrenals is it's not always because of like stress or tension. Sometimes it's actually because of fatigue, and then the way the body tries to compensate is it kind of does a low grade activation of the adrenals, and then it just keeps going down that road. And so they run on a little bit of like low grade adrenaline for a while, and then at some point they just have depleted adrenals, but they're still overactivated.
Yeah, she falls asleep. Like she was at the appointment. It was a doctor she was interested in pursuing. So I said, you can come. And I had to kick her because she's like falling asleep. So that's why I don't think of her. She's like a lot of fatigue.
Yeah.
She falls asleep easy, but she's constantly going to the restroom.
Yeah, I would say that like sometimes what happens when you start to calm down the adrenals or regulate them down, she might get a little bit more tired for a little bit. And it's just because her body is starting to rest better, and it starts to kind of recharge the battery, so to speak. And it usually doesn't last for a long time, but it might be like a few days or a week where she's even more tired for a little bit, but it's because she doesn't have that low grade adrenaline. And so
so margarine, a couple drops daily in water, and then putting a liniment on her abdomen like every morning or something.
Yeah. If her skin can handle it, she doesn't even have to make it in a liniment. I mean, a lot of times you can put it in like a little bit of lotion, but if their skin can handle it, you can just put like 4 or 5 drops in your hand and just rub it on the low abdomen.
Okay.
And that will be good. Like I have pure, like, not mixed with massage oil or something, marjoram in a roller ball, and I just roll it on the spots that I want to hit. It doesn't aggravate the skin. It's usually pretty gentle, but if somebody's like too sensitive, then put it in a little bit of lotion or a little bit of alcohol or witch hazel or, vinegar, something as a carrier.
Is there something I would recommend that because of her depleted adrenals?
First, I just get them to calm down.
Okay.
Usually you could do a couple of things. You could do rosemary, you could do camphor. Sage is a really good one because it's strengthening to the body, it's strengthening to the adrenals, it's calming and soothing to the nervous system. Sage is considered a cure-all, and so that means that it starts to balance out a lot of body processes. So usually I go to the sage.
And which sage? One in particular?
You could use regular sage, but I usually go to Spanish sage because you can do much larger dosages of Spanish sage than normal sage. And I'd like to see her have like big dosages of sage.
What would that be, like in water, you mean?
Like a liniment or lotion or a salt bath, so topically, like daily though.
So topically on what part of the body?
Wherever she can get it. Just like if she can cover the whole body, great. If not, just if you can get it on the arms and legs, or if you can get it on the torso, the abdomen, just wherever she can get the sage. Just
okay.
Yeah, it feels pretty good. So a lot of times what happens is people will start rubbing it all over their body.
In water too, or just mostly topically?
No, just topically.
Okay,
Yeah, no need to take that one internal.
okay. Okay, thank you.
You're so welcome.
Go ahead, Donita.
Hey, Donita.
On. Hi.
Hey.
Hi. I have a few questions, if I may, please. Let's start.
Of course.
Let's start with. I have a client, and she's 79 years old, a new client, and she was diagnosed. You know, my session. I'm not a praniculus, but at the same time, she was diagnosed with kidney problems, like
Like what kind of kidney problem?
actually chronic kidneys disease. That was the diagnosis.
What is it called?
Chronic kidney disease.
Pranic kidney disease?
That's what she told me.
Who diagnosed that?
Her doctor, her primary care.
Oh.
The doctors, her doctor.
Huh.
So that's what she said. It is chronic kidney disease. Basically, her kidneys are slowly giving up.
Okay.
Because I asked her, what does it mean? And she said, like, they're just slowly giving up. So I suggested, chronic, maybe chronic.
Yeah, I think it's chronic. Yeah,
Because I heard her
Chronic
say
kidney disease.
chronic, but
Yeah.
it might be. So I suggested, herbs for kidneys and all that, like tinctures and stuff. But I was very curious to ask you, what do you think in terms of oils? She's willing to buy whatever to help her.
So here's the thing: when the kidneys stop functioning quite as well. First off, do we know how many times a day is she urinating?
I don't know.
Okay. Does she have a lot of fluid retention?
She didn't look, it was a Zoom call. She didn't look like it.
Okay.
Like, I don't know the details of that.
So a couple of things. I would ask, like, how many times a day is she urinating? What color is the urine? Like, is it clear? Is it dark? Is it straw color? Like, what color is the urine? And then, she could just like look in the toilet afterwards and like, what, is it real super dark? Is it clear? Just you can get information that way. And then puffiness or swelling in the legs. Those would be the three questions that I would say. But is she diabetic?
No.
Hypertension?
Oh, I don't know all this because the
Yeah.
session was about a completely
Yeah.
different topic, but that came
Mhm.
up. So
Yeah.
it actually came strongly as that I would ask you, and she's open to taking whatever just to help her
Okay.
bring it into
I would be
balance.
curious about if make sure that there's no diabetes. And then also if there's hypertension and how long, how bad. So
I can
the thing
email
with
her and ask her all this.
Yeah, that would be great. So
Mhm.
the issue, like when the kidneys are starting to not function super well, the oils can be a little bit hard on the kidneys. And so it's not always, like I'd say, if the kidneys are just not functioning well, but they're not degenerating, oils work really fine, especially like something like lovage or parsley, celery, things, even Greenland moss to improve function, to help with elimination, to help filter and purify the blood, things like that. But when you start to have like a kidney disease like that, oils, they can be helpful, but sometimes something that's, instead of using a volatile oil, using something like an herb can be softer and gentler on the kidney and be quite effective. And so the thing that I would put her on right off the bat or suggest would be cordyceps. Cordyceps are a mushroom that increases and improves kidney function. It increases and improves heart function, and also helps with lung function. But
You're frozen.
so I would get a good source of cordyceps. The issue is that, you know, the cordyceps, the further away it's from the mother, like the mother mushroom or the mother mycelia, the weaker it becomes. You know, after 5, 6, 7 generations, loses its potency. So couple companies make a pretty good version of it. Host Defense is one. Is Shaman Shack still open? Okay, Shaman Shack is a place where you can get the powder. It's actually a cheaper way of doing it. The cordyceps doesn't really have a super strong taste, so she could just mix it in her coffee or water or whatever and just shoot it down. It's going to be significantly cheaper than getting it in capsule form. So she could take a bigger dosage, but you know, I would like you to see her take the equivalent to 3,000 to 4,000 milligrams a day, which would be the equivalent to like 6 to 8 capsules. So that would be probably a good, healthy teaspoonful a day. It would increase our energy levels, but over a period of time, it would help improve kidney function and be gentle on the kidneys at the same time. And so that's where I would start her and see how the body responds after 30, 60 days.
Okay, perfect. 30, 60
Yeah.
days. She's
Yeah.
also willing to take salt baths. Anything you'd
Yeah.
recommend?
Black spruce.
Black spruce, not chacorodinse, just and how many drops and how often?
In the bath, like 12 to 15 drops. She could actually apply black spruce to the kidney area, you know, either straight or in a little bit of lotion, like rub it over the kidney area. That could be very helpful, but nothing internal. Like no oils internally. I mean, it's not going to be harmful. It becomes harder for kidneys that are degenerating. It becomes harder for them to process the oils.
Plus,
Like
she's
when taken
79.
internal.
Plus, she's
She's what?
79. She's 79 years old. That's why I was like, oh, that's an older.
Yeah.
And besides black spruce, and how many times a week would you recommend?
Oh, daily.
Oh,
Yeah.
daily.
Yeah, it's going to be a daily thing.
Would you recommend any other oil like root cleanser in a salt bath once a week or something, or anything lavender?
She's going to have to really double down on that black spruce. Yeah, like that's going to be her new best friend for a while.
Okay.
Yeah, like
Cool.
you got to get the kidneys to rebound and strengthen, or at least slow down the degeneration.
So this is the
Yeah.
number
Yeah.
one. Okay.
I mean, between the cordyceps and the black spruce, that's I wouldn't say super aggressive, but relatively aggressive towards just targeting the kidneys, and just you almost kind of set aside some of the other things that you would do to just get those kidneys to function better. The other thing is she throwing up?
Not that I know of.
Okay, like point blank,
I'll ask.
like ask her the last time she threw up, regardless of why. Could have been food. She could have thought she had food poisoning. Doesn't matter. When is the last time she threw up?
Mm-hmm.
When the kidneys stop functioning well, the tendency is to vomit.
Oh wow. Okay.
Yeah, you wouldn't put that together, like you know what I mean. It's not like you'd go, oh, that's kidney function, but it will start to be more and more often.
Oh wow.
Yeah.
Okay. And cordyceps, can they cause allergic reaction to the body?
I mean, it's always possible, but I haven't ever seen it happen.
Okay.
Yeah.
Okay. Wow.
I like when you have to go and treat something really aggressive. I especially when it's like something like this or something immune related. I like mushrooms because you can do big dosages and there's not a lot of weird side effects with the big dosages.
Mm.
You know, your body can handle large dosages of mushrooms.
Okay, I like that. Thank you so much.
Yeah.
So we'll start with this, and then I'll keep an eye on her, what she's doing.
Yeah. I mean, if she's concerned about it, you know, she can start a little bit smaller and let her body acclimate, but getting up to 4,000 milligrams a day. I mean, I had a couple patients where they actually even had kidney transplants, and there was a Chinese study where they were trying to rehab the kidneys, and then the person had the kidney transplant, and cordyceps could be used even after the kidney transplant, which usually you wouldn't use anything that could stimulate the immune system, because you're actually taking things to diminish the immune response, so that the body doesn't reject the kidneys, you know, for the transplant. But the cordyceps help the body to heal, help strengthen the kidneys, and didn't stimulate the rejection response within the body towards the kidneys. And so it really has this like adaptive quality to the cordyceps. And so cordyceps, I mean, there's a handful of mushrooms that are amazing. Lion's mane is one, cordyceps is one, you know, not Ganoderma, reishi is what most people call it. Reishi, maitake, amazing. Like they really are pretty amazing for the things that they do. Yeah, we eat lion's mane all the time. Yeah, it's really super good for your brain.
So you take it also from that powder? You get it in the powder?
We were doing the powder, but now we just buy big hunks of lion's mane and we just eat it.
Yeah,
It's really quite tasty.
It's delicious. I found when we lived in California, I found some and I had to
Oh
cook
boy,
because I was like,
lucky you.
ooh, in a
Yeah,
while. I
lucky
know it
you.
was massive. But that made me ask, I mean, brought up, I've got an acquaintance, she's 30 now, but she ended up actually having a kidney transplant at the age of 16. So nearly 15 years ago. And her health is really very, she's very, she can't handle a lot of life, put it this way. Will cordyceps be good for her?
Yeah, that it's been so long and she's got some questionable health issues, like little tiny dosages. She might even want to, I mean, if she talks over with the doctor is going to tell her no, but I would still tell her to talk it over with her doctor. You know, the thing is like with the kidney transplants, is there's a lot of factors in there, and don't even try to like guess what's going to help or not. Just let her talk it out with her doctor and see. Like you don't want to complicate it or make it worse.
No, I just thought, you were talking, so I was like, oh, might as well just ask because, anything, she's young.
I mean, for something like that, you could start with a little bit of tea, like, put it in tea and just drink like hot water and a little bit of cordyceps, and then she could see. But like if she's had a transplant, they're usually monitoring the kidney function, and so if even small amounts start to change something, they would be on it usually.
Okay. Thank you so much for all of
You're
this.
so
welcome. Okay, now I have another question, and that's follow up from last week. I asked about my husband. He's away, and so as soon as it was interesting because he was open, right? As far as I knew. And as soon as I mentioned to him all this, he had a bit of a panic attack almost. He just flipped.
What did we?
Yeah. We talked about he's open to some healing, right? He's open to do some therapy. So you actually suggested him to, because you saw it in the lower chakras. He had childhood abuse, sexual abuse. There's a lot of trauma. There's a lot of, and then you recommended him mugwort on joints, sacred sage to breathe, to do the lower pattern, galbanum 2-3 drops internally. There is pain in the body. He's a bath or scrub. He doesn't have a bath. Okay. But as soon as I mentioned all that, he just went into a big no, into like defensive and into to shut down. So like there's a big no. So my question is, since
Will he do one thing?
He would probably, I don't know, but not
Mugwort on the joints.
mugwort on the joints. Okay.
Mhm.
And quick, because, talking to the previous people, I think Sandra and stuff, how do I clean this? I'm not a prana killer. What can I do to help without, I don't know, like I'm not a prana killer, but I've got, the poor, but the Dorje. How can I assist him? What can I do to clean up the lower chakras, to clean up some of that gunk, for him to?
Start with just having him put the mugwort on the joints. That will actually start to clean that up a bit.
Okay, he's very sensitive to the skin. He's
But
very
mix it in some massage oil.
okay.
Yeah, and then just have him dab it on the joints.
Okay. And he's also like the one that throws up in the mornings, wakes up. He's like the fatigue. He's moody. There is like I feel it's getting worse in a way. Depressive.
Why is he throwing up?
That I don't know. He's been doing it for years. First thing he does in the morning, he throws up. He does have, he used to dive quite a lot, so he thinks it's the stuff goes like the ears are perforated or something.
Has he run that by his doctor?
Yeah, I mean, there's nothing. That's why I brought it up, because there's like the kidneys are fine. I mean, more or less, but they're fine.
Well, there's other reasons why a person could be throwing up. Wow, every day?
No, well, not really, but a lot of the time he goes through waves of it, and every first thing he does, it's pretty intense.
Does he have diarrhea?
He has, yeah, I mean, nothing stays in him too long, put it this way. Doesn't have diarrhea, but it's like quick. If the food is not right, he's
What
traveled.
about inflammation in his body? Like when you touch his body,
Oh,
like the superficial tissue, is it real, like, not the muscle, but like the skin? Like, is it like kind of soft and moist?
yes.
Okay. He's in fight. He's a massive fight.
Oh, I know that. For
So
years.
marjoram. So have him do the mugwort on the joints and inhale marjoram, rub marjoram on the abdomen.
That's
But just
another
1, 2, like that. Just 1, 2 things, like marjoram or mugwort on the joints, and inhaling marjoram. Just like have him do everything with marjoram.
That's another thing. His belly button, God forbid if anybody even looks at his belly button. I mean, it's all irritated. I mean, God forbid if to touch it, that's like the end. It's the end. I mean, he can't. He teared all his t-shirts. So
It's poor vagal tone, and so it causes vomiting, it causes diarrhea, it causes irregular bowel movements. But like one of the other indicators would be the really superficial tissue, like where the skin, it gets real soft and moist. All of that is an indicator of poor vagal tone.
okay.
So the marjoram tones the vagus nerve. And so just by doing that over a period of time, it will calm down his gut and will allow him to sleep better and get him feeling better.
Yeah, that's about the sleep. He sleeps like 2 hours, wakes up. It's 2 hours.
Even 2 hours, he's probably not sleeping very much. Like it's not deep sleep.
No.
I guarantee he's not sleeping.
Oh
very
no,
well.
that's a lifelong of
Yeah.
deeply rooted trauma that has never been expressed, never been dealt with.
Yeah.
And he just
So just those 2 things. And if he'll only do one, marjoram.
he has that with him. He's away. He has that. So I'm going to email it to him.
Marjoram.
And
Yeah.
what about galbanum internally? Well, he will take that. He has that. No, for pain.
For pain, I mean, it does help with the gut a little bit, but if he'll do 2 things, the next thing I would have him do would be the mugwort.
Mugwort and marjoram. Okay.
Mhm.
Okay.
M&M. Mugwort and marjoram.
Beautiful, and probably, yes. Okay, thank you so much. I'll hopefully, and I can't do anything from home to assist.
To improve the vagal tone is with energy work is very complicated.
I know.
The marjoram is such an easier path to treat it. The other stuff, it's really super technical, and honestly, a lot of times the marjoram, because it's it's got chemistry behind it, the chemistry of the oil, it's a little bit more physicalizing, and it sometimes actually even works better. And I would just let that happen. The thing with a person that's poor vagal tone and in fight flight is their system gets overwhelmed very easily. And so I would say, like, you're feeding him teaspoons at a time before he gets strong enough to where he can do more.
Okay, yeah, that's just him to the T.
Yeah,
I feel him. So I've been doing my the action inertia, like in poplar balsam, but the last literally a few weeks, I was going to ask you about me. I was like, I've been feeling all and everything raw. I've been feeling really raw myself, and I was like, what is that about? Just
put poplar balsam on your navel and about 1.5 inches below your navel.
Okay.
And then on the soles of your feet.
Poplar, because I've been,
but
just
2 or 3
poplar.
times a day. 2 or 3 times a day.
Jeez, that's fancy.
Yeah.
How long for how long?
You're pretty fancy, so.
Yeah, right. Yeah, that's why I'm stressing. That's really about the fanciness. How many days? How many?
It like you could put it like a little bit in lotion and then just rub it like that way. It doesn't have to be several drops. You just take like a drop and put it on that area, a drop on the 1.5 inches below, and then a drop on the soles of the feet. Or you could just put several drops in lotion and then mix it and then just rub it on those areas. Like, I have it in a roller ball that I do for myself. And, I just, it's already mixed with some jojoba, and I just roll it on the spots, and that way it makes it last a while, but it's still effective.
So how many drops in a roller? Because I have rollers.
When I make the roller balls, I put 4 mils in a 10 ml bottle. So it's like 40% oil and 60% jojoba. You could do whatever version of that, but I make it actually relatively strong.
Okay. And how many days do I do this till I feel better? Do I?
You're like at least 30 to 60 days.
Holy moly. Okay.
Yeah.
Okay. Do you know what's happening?
It's to help balance out some of the centers. Yeah.
Okay. Okay.
Yeah.
I mean, do you know what my question? Do you know what's happening with me? What's
Yeah,
that?
it's the some of the lower centers are not like sequencing properly.
Okay.
Yeah.
Okay. God.
I mean, you've had a lot of shifting and changes in your world, and it's
everything at the same time.
part of it's that. Yeah, part of it's that.
Yeah, it's everything at the same time.
I wouldn't read a lot into it. Like, it can happen with meditation. It can happen with changes in your life. It can happen with shifts in your work. It can happen with shifts in relationships. It can happen with shifts in the environment. It can happen for all kinds of reasons. The key is just to recognize it and then treat it.
Okay. All right.
I treat it on myself all the time.
And do I continue with action, inertia, and integration? And
Yeah.
poplar balsam to breathe that, like the transmutation pattern, right?
Right.
Okay.
Yeah.
Okay.
Keep doing the thing that you've been doing. Yeah.
Anything else?
No, I think that's good. That's pretty solid.
It's like that solid poplar balsam bath. Thank you so much, Greg. Happy
So-
New Year.
Oh yeah, Happy New Year to you too. Yeah, I keep forgetting it's almost the new year.
I think I'm good. So thank you so very much.
Go ahead, Barbara.
Hey, Barbara.
Hey there. For the past while, could be maybe several months, I'm having increasing crunchiness in my neck. It's like I can
Okay.
feel the bones rubbing against each other and making noise and just not feeling comfortable. I think some of it's positional, the way I sleep. I keep experimenting with different pillows, and I think it's also.
Is it just like the back of your neck?
Yeah, but it's almost the entire cervical spine.
Okay. What about your shoulders? When you move your shoulders, are they kind of grinding or popping?
Oh yeah, the right one's popping a lot. I hadn't really noticed.
Okay.
The left one, I don't notice that.
Okay.
I think some of it's also the angle of my neck, keyboarding and staring at the screen.
Yeah,
all the
so,
Zoom
so-
time.
some of it can be sitting at a computer, some of it can be just holding your body in a fixed position for a while, but so you could use a couple different oils. So first I'll give you the choices, then I'll tell you how to apply.
Okay.
Spikenard would work, vetiver would work, valerian would work, marjoram would work. Pink pepper would work. You probably don't have that, but that could definitely work. Even helichrysum could possibly work in this arena. I would even throw out potentially even larch and Siberian fir. And so if you have just one of those,
I
let's
have a
just
few
start
of
with what,
those.
yeah. So I'd start with, like different people they're going to respond a little bit differently. So like I kind of like to give you a few options and then have you start kind of playing with the application and see what works for you. And so the popping in the neck, a lot of times you're gonna take some of those oils and you can put it in lotion, or if your body can handle it neat, you can do neat, but do like around your ears, like down into like where it comes all the way down into the jaw, and then go around the base of the skull. Like, hold on. Okay, so here's like the base of the skull. So you're gonna kind of like, this is like where you would like feel it. You're just gonna go all along this area, and like right where I'm pointing is where
Like
the
indentation.
yeah. So you'll go on each side. And you can feel kind of like where the muscles attach in that area.
Okay.
You're
yeah.
gonna really want to rub the oil into those spots. So rub it into those spots, in and around the indentation, and then the shoulder popping is. I mean, you could also just explore, like especially the backside of your neck. Like if you go like up a little bit from the base of your skull, like if you kind of come up and you start to come around, like in this area, like right about here, you'll feel like a little indentation about the size of a dime. Like, it's like there's like a little band that kind of goes across here, and then there's like a little circle that's about the size of a dime.
Right. Just kind of
there's
above
actually
and inside the bones, the
What's that?
prominent, just above
Yeah.
and inside the points of the prominent points of the bone. Okay.
Yeah, like there's a trigger point there that what you're trying to do is there's this like kind of plane of fascia on the backside of the head, down the neck, and into the upper torso a little bit, called the nuchal ligament. It's not really a ligament, it's a plane of fascia. And so what happens is that will get really restricted, and then it starts to cause the issues in the cervical vertebrae, and then down into the shoulders, and in particular the shoulder girdle or the rotator cuff. And so by applying those oils like around the base of the skull and around the ear, and then taking it, in those where the muscles attach at the base of the skull and that little indentation on the side, you're starting to unwind the nuchal ligament, And, you know, you can apply it down the neck, but you'll usually find more relief from working the head and around the ears than you will actually the neck itself. Because part of it is there's a joint like that's inside your head a little bit that if you kind of relax and loosen that joint up a little bit, it takes some of the superficial tension out of the cervical vertebrae. And so the one that's going to be a little bit harder for you to reach is the popping and like the popping and a little bit of grinding in the shoulder is actually the shoulder blade itself. Like, you know, like here's the shoulder blade, it's the big meaty part of the shoulder blade. It's called the infraspinatus, and that is tight. And so, I mean, if you can reach it to get something on there, if not, you might have to treat it with, you know, doing it in baths but basically the same oils, but just on that shoulder blade itself, that muscle. And just over a period of time, if you keep relaxing it, like the shoulder girdle is not tracking properly because of the tension in the infraspinatus, and it causes like a popping or grinding sound in the shoulder. And so if you have to hold your arm in a fixed position for a while, like on a mouse or doing computer work, or, you know, you're writing a lot, anything like that, it actually is super aggravating to that muscle. And so, you know, it could be from an old injury, it could be from body posture, it could be from all kinds of things, right? But
Sleeping position?
Yeah, it could be sleeping position, it could be an old injury, it could be sports when you were young. You know, I mean, there's so many reasons why it could happen. But if you treat that over a period of time, a good chance the popping and grinding will stop. Like the shoulder will definitely feel better, but there's times where we've made the popping and grinding completely stop because it starts to track, you know, it starts to make the shoulder track better. One of the things that I like about using something like spikenard or vetiver on some of these areas, for one, they're antispasmodic, they're super relaxing. Vetiver will increase circulation, spikenard too, but spikenard and valerian in particular are really good for helping to balance out muscle imbalances. And so if there's been a muscle imbalance through overuse or through, like sometimes if there's inflammation in an area, it will throw one muscle group into a spasm and then another group will lose tone. It helps to bring like an equilibrium between the opposing muscle groups. And over a period of time, we just accumulate these like muscle imbalances just from posture and structure and repetitive use and injuries and how we hold our head, and like you said, like sleep, and sometimes even like inflammations like colds and flus in the body will actually cause muscle imbalances, you know, because you get super inflamed, throws things in spasm, some things lose tone, and then you come out of the infection and then you have this muscle imbalance that then you're just compensating for. And so pink pepper, I mean, there is kind of a multifaceted approach to doing this if you wanted to. I'd say right off the bat, pink pepper wouldn't be like a go-to thing, but pink pepper or the fascial release stuff blend could be helpful. But pink pepper is good for stimulating circulation. It has an effect on trigger points, and it has an effect on fascia. And the fascia just helps to keep loosening up and making space for the muscles to balance out and relax and get more ranges of motion. And so again, that nuchal ligament is a plane of fascia. And so it has like a hydrating effect on that fascia. And anytime you want fascia to release, you hydrate it. You know, like if you do things that dry it out, it actually is more constrictive to the fascial tissue. If you hydrate it, the tissue just kind of unwinds, like it just fluffs up a little bit. And so that's where I'd work that for a little while. Like it, will take some of the pressure out of the neck. The other thing, like after you get through doing that, is like put all that on, and then either with hyssop decumbens or larch, just take several long, slow, deep breaths. And it helps to kind of reset the nervous system and have a deeper releasing effect on the fascia. And you can unwind body patterns in the body quite effectively with that variation. This was, oh boy, quite a while ago, but I would take people where I had like a, what do you call it? Like a plumb bob from the ceiling, so you had like a string where you could have them center up their feet and you could see if they were leaning off to one side or the other. And then we do like side views. And so we would see the misalignments, and I actually would do a thing where I'd measure the ears for like tilts and then rotations. And then we would do a variation of what we're talking about right now. And so the application to the base of the skull, the neck, and some of the shoulder, and then do the hyssop or the larch. Actually, back then we didn't have larch, so it was hyssop. And you could literally watch their posture shift and change like before your eyes. Like it was the bizarrest thing to watch. Like they would actually start going into alignment without trying to put their body in alignment. Their body would just start to unwind and loosen up. And so if you do it over a period of time, you'll break out of some fascial patterns. And do you have any low back pain, by the way?
Generally, no.
Okay. You're not aware of it?
No, I mean, sometimes when I lift, I feel a little, not super low, but more actually around the area of the Mingmen. Yeah, I guess that's low back.
Okay. So treat whatever you're putting on your neck and your shoulders, put on your hamstrings as well.
Yeah, they're tight for sure.
Yeah, like if you loosen up your hamstrings, the low back will regulate. Because like a lot of times, whatever's going on, like at the head and the base of the skull, will manifest in the low back. Like it's like whatever happens in the head happens in the pelvis, and vice versa. Like if the pelvis is off, it throws the head off, and vice versa.
As above, so below.
Yeah, and so like if you have that, it starts just following this like train down all the way to your feet. And so if you're having that there, I mean, I would start treating the hamstrings as if you have a hamstring issue and just start unwinding the low back.
Okay, really quick, because I know we have to go to the next session. Should I treat both shoulders or just the one that seems to be aggravated?
I treat them both, but like the one that's not bothering you, you could treat it from time to time, but the other one, I'd treat it often. The one that's bothering you, I definitely would treat it often.
Thank you so much.
You're so welcome.
It's time.
Wow, that just flew by. Okay, we're gonna cut out and go to the angel link. So thanks, and we are on for next week. So I hope to see you next week, and you guys have a good New Year if I don't. So.
And we'll hopefully see you guys over at the angel practice. I put the link in about 3 minutes ago, so love to have you guys join us.